out some quizzes and some recap for the courses that we've done. But of course, you will be shown the informations, and then we will go into some quizzes, some interesting quizzes. And at the end, you'll be having a gift. So I hope that it will be fun for you, and don't hesitate to enter your name to participate and vote. And of course, you can enter whatever name you want if you want it to be anonymous. So let's have fun and learn more things. So this is just some information about me so that you can know a little bit more about me. So I'm a 7th year medical student in UISS. I'm deeply passionate about medicine and dedicated to helping others. So I have some certificates and accomplishments. I'm a member at Les Randonneurs and former president of the Office of Sports, Arts and Associations. And I'm a student council member at my university. I have some other things that I've accomplished. And of course, if you have any other questions, you can ask me here or in private so that I can tell you how to do it if you want to. Today's objective is to reinforce the knowledge you've acquired through targeted quizzes and ensuring a deeper understanding and retention of the material covered. So are you ready? You can enter whatever you want so that I can see your responses. It's like a test so that you can see if you can. Okay. So we have people who know how to use the app. Okay. Absolutely. Well, we have some excitement. Okay, ready. So I'm excited for you too. Okay, let's begin. Oops, there was someone who wanted to write something. Word vamos. Okay, good. So let's start. This is just some information. I want you to focus on this one because you'll be having some quizzes on it. So this is the different nipple discharge. I want you to focus on it because I've had it as a question in one of my 7th year exams. It was the question about the red discharge. So focus on this one and try to obtain as a maximum of information as you can. So for the white, clear or cloudy discharge, it's mostly because of the breastfeeding, galactorrhea, hypothyroidism or procalcitonoma. There is the yellow discharge. It mostly indicates hormonal fluctuations, infections. There's the green, brown or black one. You can think of the duct ectasia, intraductal papilloma. And the red, pink or bloody one is dangerous. And most of things you have to think of is the intraductal papilloma and the breast cancer, which can be, of course, it's a bad pathology. And then we have the characteristic of the physiological and pathological nipple discharge. So for the pathological, we have bloody, clear, spontaneous, unilateral, palpable breast mass. You can even observe skin changes, nipple retraction. And for the physiological one, there is the bilateral, non-spontaneous, milky, green, yellow, brown, or negative physical exam. So we wouldn't find something that will draw your attention. So this is the first question. Okay, we have 8 players. Does anyone want to join? So for those who want to join, who couldn't join at first, they can just enter to menti.com and then just enter this code. Okay, we will wait just some 2 minutes for the other players to join if they want to. Then we will dive. Okay, so now we will begin. So just 1 more minute and then we will start. So we have 17 questions and this is the first one. Okay, so now let's start. A 30 years old woman presents with bilateral milky nipple discharge. What is the most likely cause of her symptoms? Duct ectasia, galactorrhea, intraductal papilloma, or breast cancer? Okay, 2, 1, and 0. Yes, so it is galactorrhea, and all of you was right. Okay, so Hafsa was the fastest one. That's good. And then Clippy. Okay, let's go to the next one. So as you can see, it's anonymous. So anyone who want to join us, they can just go to menti.com and then enter the code. It's not too late to be here. So just start. So be fast to gain more points. Which characteristic of nipple discharge strongly suggests a pathological origin? Bilateral discharge, discharge from multiple pores, discharge only upon compression, persistent unilateral clear discharge from a single pore. Okay, so we had 4 people who answered right, and the other one, it's okay. You have more questions to have the right answer. So yes, it's a persistent unilateral clear discharge from a single pore. Okay. So now we have 7 players. So which color of nipple discharge is most commonly associated with infection? That was quick. Well, it was the green one. The green one is associated with infection, not the yellow. Okay. The yellow was the hormonal fluctuation and okay. So Clostridium is the fastest one. This one. Okay. So green or brown discharge can be indicative of duct ectasia, but it's also commonly associated with infections, especially in the context of other symptoms such as pain and inflammation. So you have to think of it when you have a green discharge. And then we have our next question. So a patient reports the recent onset of nipple discharge that is green in color and comes from multiple pores on both breasts. How should this be classified? I'll let you just some seconds, 5 seconds to read the question, and then we will go to the voting phase. Okay, let's go to the question. Okay, where is our eighth player? That's okay. So there is 7 players, and I'm proud of you that you're still here trying to win. Okay, how should this be classified? Physiological due to likely infection, non-suspect unlikely due to benign change, pathological requiring immediate biopsy, insufficient information to classify. Okay, that was quick, but we have different answers. It's not physiological due to likely infection, no. It's non-suspect and likely to do benign change. We will see why. Okay, so we have 2 people who answered right. So this is the explanation. It is multiductal bilateral green discharge. So it is more often associated with non-suspect benign conditions like duct ectasia, though concurrent symptoms should be associated to rule out infections. So here we don't have symptoms, and it's bilateral, so it's most likely a duct ectasia. Now we have the 5th question. Okay, so we still have our 7 players and they are all ready. So here is the question. What is the most appropriate next step if a patient presents with unilateral bloody discharge? Reassure and observe, initiate empirical antibiotics, order diagnostic imaging and consider biopsy, treat for fungal infection. So what will you do? Okay, that was quick and it was right. So really good. That was really good. Okay, who answered fast? Okay, we did this one was the one answering fast, but Clostridium is still the first one. This is the explanation. So for unilateral bloody discharge, it is concerning for malignancies such as intraductal papilloma or breast cancer, necessitating further investigation with imaging and possible biopsy. Okay. So as I said, for anyone who want to join, we still have 11 questions left. You can just join us here and then enter the code. Now our next question. Okay, thank you for those who are doing like. Initial radiological test for 63 years old with a palpable nodule and skin retraction in the left breast. Will you be doing echography alone, mammography plus breast ultrasound, or just MRI? Well, I hope you guessed this one right. So we have different answers here also. Okay, so we will be doing mammography plus breast ultrasound. So it's a 63 years old woman. So an ecography alone will not be sufficient. And the best thing is to do the mammography plus breast ultrasound to determine what is the nature of the palpable nodule. And we have some criteria that should make you worried because she has skin retraction. Okay, Hafsa was the fastest one. No, not the fast. She's the first one. She surpassed Clostridium, and then we have BNG Amen. I guess he was the fastest one. Okay. Should we wait for the seventh player? Okay, so now you're... Okay, we are at the seventh question. So you're really going really well. At what age is mammography screening generally initiated if there are no prior family history of breast cancer? 40 years old, 45 years old, 50 years old, 55 years old. Which one will you be choosing? Okay. Oops. That was good. Most of you answered right, and I hope for the other ones to answer the rest of the questions right. So it's 45 years old. Okay, let's see who was the first one to answer. Okay, Clostridium was the first one to answer now. But Hafsa still the first one. Okay. For the ones who wanna join, they can just go here because I know sometimes we just click on something and then we go out from the game. So you can rejoin us by just entering menti.com in Safari or whatever, and then just enter the code. Okay, so now let's go to the next question. Which imaging modality is preferred when dealing with dense breasts in a diagnostic context? Okay, that was quick. Okay, both mammography and ultrasound, remember. Those two are really important to remember. Okay, let's see who was the first one. Okay, Jamila, that's good. For embryo, you still have more questions, so you still can win. Okay. Which is a contradiction for performing a mammogram? Age below 30 years, pregnancy, presence of breast implants, previous mastectomy. It's age below 30 years old. Pregnancy is not a contradiction for it. Also, breast implants, no, it's not a contradiction. Mammography has radiations, so it's preferable that patients under 30 years old doesn't undergo this test. They can just do ultrasounds. It's sufficient for them. Okay, 6 players. Well, that's good. You're still here with us in the 10th question. So what does a Biret's category of ACR3 suggest about a lesion? Okay, 3 people answered, 4, 5, and then everyone. Okay, that's good. It's for this one. It's probably Benini, but there is every professor suggests every professor suggests a different procedure to do. So I would say the two of these answers are right. Two of them are right. I can say that this one wasn't right, but let's just go with this one now. It's still suspicious. It is recommended, but the patient can refuse to do it and just do a follow up if he wants to do it. Okay. So here is the explanation. So for ACR1, it is definitely benign. ACR2, it's benign finding. ACR3 is probably benign, but some professors argue that it can be suspicious sometimes. So they can go for the biopsy to just eliminate the risk that can the patient have. So you can say that both answers are correct. It just depends on the one you will be having as your medical doctor. And for the ACR4, it's suspicious. For the ACR5, it's highly suggestive of malignancy. ACR6, it's known biopsy proven malignancy. So it means that the patient has done the biopsy and it's proven that it's malignant. And for ACR0, it needs additional imaging evaluation. Okay. So what should the management be in ACR3? No, it's not immediate biopsy. We've said that you can suggest for the patient to do the biopsy, but the best option is to do a follow-up in 6 months. Okay, so now let's see who answered right. Okay, it was Clostridium and we did. Okay, so now we just have uh, 6 questions left. What is the standard procedure after identifying a lesion classified as ACR4? Yes, so it's biopsy. That was a really good answer, and I guess all the people that answered this right. So Jamila and Embryo, I wish that you can answer too, so you will have a higher chance of being at the top. Okay, let's continue. Thank you for the like. Answer fast to get more points. Which scenario most likely warrants the use of diagnostic mammography? Routine screening, or 35 years old with a palpable mass, annual follow up in a patient with previously diagnosed cancer, 50 years old coming for their first screening. So this is above 30 years old. Last time we said that if the patient is under 30 years old, she shouldn't do the mammography, but now this is a 35 years old patient with palpable mass. So it's suspect, so she should do a diagnostic mammography. Because she has a symptom. She's above 30 years old and she has a symptom. this patient doesn't have any symptoms, and this patient doesn't have any symptoms. So it's more of she's just coming to discover what uh, there can be, but this one has clear symptoms, so she should go for a diagnostic mammography. Okay, Clostridium was the fastest. Okay, let's continue. Which technique provides a 3D image of the breast and helps in detecting cancer not visible on traditional 2D mammography? Is it the breast MRI, breast CT, tomosynthesis, or ultrasound? No, it's not the breast MRI. It's the tomosynthesis. It provides a 3D image. It's similar to the traditional mammography, but it has a 3D image. We don't have a lot of this in Morocco, but I guess just in Fas and Rabat and Casablanca, you can find those. Okay, so that's good. So Hafsa is the first one. And Brielle and Asia, where are you? Okay, so now the seventh player joined us. Okay, so we have 8 players. That's good. What is the purpose of placing a clip in breast tissue during biopsy? Is it to mark the biopsy site for possible surgical excision, to cause intentional scarring to prevent tumor growth, to enhance the aesthetic outcome post biopsy, or none of the above? So, why do they do a clip? Okay, let's see. Yes, it is to mark the biopsy site for possible surgical excision. It's like a guide for the surgeon who will do the excision. Okay. Oh, Anna, I'm proud of you. So Anna just joined us and she was quick to answer and had the right answer. That's good. Where is the eighth player? So we have 7 players. Okay, now it's 8. That's good. Good luck in this one. What criteria differentiate a diagnostic mammogram from a screening mammogram? The diagnostic mammogram is only used post-surgery. Diagnostic mammogram is used when there are clinical symptoms. Screening mammogram is performed biannually. Screening mammogram use a higher dose of radiation. So this was the right answer is the diagnostic mammogram is used when there are clinical symptoms, and the screening mammogram is used when there is no clinical symptoms. So usually it's for the patients that will come for checkup who are 45 years old, 50 years old. They will do screening mammogram to see if there is new lesions or new things that will appear in the mammogram. Okay, that was good actually. So there's Hafsa, then Clostridium, then Widad, then BNG, then Jamila, then Clippy. But you still have more questions to answer, so we can't know who will be the winner. Okay, let's wait for the number 8, in case he want to join. Okay, just 3 seconds and then we'll begin. Okay, so now the B is here. Okay, how is the quality of mammography image assessed? Visibility of the pectoral muscle to the nipple level, only the presence of the breast in the image, sharpness and contrast of the image alone, amount of radiation used. So it is about the quality of mammography. Oh, that was good. I didn't expect that most of you will get it right, but that was really good. So, yes, it is the visibility of the pectoral muscle up to the nipple level. No, it's this one was right, but there is a loan that eliminates this question, this answer. Sorry. Yes, so okay. So Hafsa still the first one. Okay. 10,000 points, but I'm proud of all the participants who voted because I know that the win is winning new information. So now we have a small recap for all of you. You can screenshot this one, so you can keep it with you. So here you can see. So the first thing is to have correct labeling. So here is the. So here you can see the correct labeling, and then there you can see the fatty strip and the pectoral shadow. So here is the pectoral muscle, as you can see. Here is the pectoral muscle and the unobscured nipple here and infirmary fold here, as you can see, and the pectoral muscle that is visible to the level of the nipple here. So it should be visible to the level of the nipple, as we've said. Okay, now you can see the other one. So this is a take-home message. And this is in French, so that it can help you, especially that here in Morocco we have medical studies in French, so you can just keep it with you, screenshot it, and then keep it with you. Okay. And as we conclude, I want to extend my heartfelt gratitude to the two remarkable mentors who have greatly enriched this presentation. All the presentations, in fact. So those quizzes was done by just condensing the information that we've done in the other presentations. So thank you for Professor Nadia and thank you for Dr. Asma Husseini. And I want you to remember that the good physician treats the disease and the great physician treats the patient who has the disease. So keep in mind that every patient is different